Hey everybody, it's Dr. LaHood with Advanced Chiropractic. Your back can only handle so much stress. It's the same with your neck. If the joint is loaded beyond what it can balance. So what I'm saying is, if your joint is loaded too much, if you lift something too heavy, if you're sitting in a bad position at your computer all day, and it's loaded, it's going to get to a point where the joint can't handle that much stress anymore. That load buckles the joint. This is what causes a malalignment, or what we call a misalignment. The joint was under so much stress, it compresses and it buckles. Now, that joint can't tolerate too much more. It can't tolerate a load like it used to. So getting up and getting out of bed, your back hurts. Just walking around, your back hurts. As it starts to loosen up, the pain may start to go down as you start to get warmed up. So your back is operating in what we call an extreme. It's out of phase. The muscles are firing out of phase with the demands of the normal task. This is what we call a functional spinal lesion, where your back is injured, it's buckled, it's compressed, it's misaligned. All that mechanical stress now begins to irritate the joint and the nerve. If the stress gets too high on the joint, you'll start to have biomechanical changes. You'll start to get calcium deposits. You'll start to get osteoarthritis. You'll start to get stenosis, facet syndrome, facet arthrosis. So when you get your MRI and it says I have a disc bulge, a disc herniation, I have neuroforaminal encroachment, this is all compression stress on the joint. Okay, it's operating in an extreme. It can't handle so much load. The maximum load you're going to reach sooner. If you lift up a heavy bag, your back is going to hurt much quicker than before it was injured. So for that tissue to heal, you have to take the pressure off. You have to unbuckle it, uncouple it. You have to distribute the stress around that joint in a better manner so it's not compressing and damaging that joint and nerve tissue. That can't be done with medication. You can't fix a buckled joint with pain medication. Okay, the pain medication helps with the inflammation, but it doesn't uncouple or decompress the joint. We use physical medicine services like computerized adjusting systems, which target the joint, target the exact functional spinal lesion to disrupt that buckling behavior. It distributes and alters the stress along that joint path much better so the patient can begin to heal. It uncouples and unbuckles and rebalances the patient. It's a computerized system. So it's very, very specific forces thrust into the vertebrae at a specific level using acceleration and computer software that will automatically shut off when that joint shifts loose. Very gentle, it's very precise. We also use computerized spinal decompression therapy. That decompression is an amazing therapy to decompress the stress off of that disc space. So if you have a degenerative disc, if you have a herniated disc, there's so much pressure built up in there that's not letting go, and you're operating in this extreme, which is progressive, which will continue to buckle and continue to mount over time and continue to get worse. The decompression decompresses that tissue and allows the stress to come off so the tissue can finally get a break. I'm talking about the nerve tissue, the ligaments, the muscles, the disc. It'll rebalance the tight back muscles. It's a gentle, soothing decompression that's targeted to specific disc levels in the neck and back to allow the patient to heal. These are all conservative measures that don't involve injections, they don't involve back surgeries. We always do a full physical exam with new patients when they come in and x-rays to see where the patient is at, to see if this treatment is going to be effective for them. If you're suffering or know someone who's suffering with back or neck pain with herniated or degenerative discs, have them reach out to us to get more information on what we do.